most famous physical therapist on the internet.
Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob. Are we rolling?
Yeah, we're rolling,
Oh,
baby.
good.
So you're having some knee pain. Is it coming from your hip or back? And we're going to kind of give you some hints how to tell.
Right. So we got some referral potential there.
Yeah, pain in your knee can come from your hip. It can also come from your back. So
Sure.
we're going to cover both areas. Now, I think, Brad, maybe you disagree with this, but the number one sign your knee pain is not coming from your hip or your back is if you push on the knee and you find tender spots.
Sure. Yeah.
So, if the hip sends pain down there, it won't send a tender spot down there. It'll hurt up here,
Right.
but it won't hurt. You'll feel pain down here, but when you press on it, it doesn't make it worse.
Or you may find there's a numb area around
Right,
there, and
right.
that could be from
Yes,
the back or
if it's
possibly
numb,
the hip, yeah.
absolutely. So you can press along. If you look at my knee here,
Ooh.
the joint line, if the kneecap right here, the joint line runs right along here, and that's often where the tenderness is.
Right.
If you're looking for a spot, that's a common spot. So let's talk about, Brad, whether some of the signs that the knee pain may be coming from your back.
Sure.
So if the pain, along with the knee pain, if you're feeling pain in your back, it's suspect.
Particularly if you're like sitting and your knee pain gets worse for no apparent reason. You're not putting weight through it. You're not moving it. And all of a sudden, boy, that knee area is starting to hurt, perhaps just from sitting more than 20 minutes or something of that nature.
Yeah, and it's very obvious too if the pain in the back is spreading all the way down to the knees. I mean, that
Right, it-
kind of takes the mystery away.
Extends.
So yeah, as Brad mentioned, is the pain worse with sitting or bending? Because knee pain shouldn't get worse with sitting.
Right.
It should maybe even get a little bit better. Does your pain improve with standing or walking or get worse?
Yep.
If it gets worse, then it could be knee pain because
Sure. That weight bearing.
weight bearing on it, sure.
Yeah.
So if you cough or sneeze and that reproduces your knee pain, then we might have a disc problem in your
Right.
back.
Yep.
Like you said, if you have an area of numbness or tingling on the same side as the back pain,
Sure. Yep.
could be back pain. And as we said, if you have knee pain and back pain at the same time,
Yes.
suspect.
Yep.
All right. Signs the knee pain may be from your hip. If you have pain in the groin or the side of your hip on the same side as the knee pain, there's your sign.
Now that's from the femoral nerve?
No, it just, it could be the femoral nerve.
Right.
Yep.
There's a one that comes down in the
Yep.
front. We actually did a video on that too. But so that yeah. Usually, if it's the knee pain is from the back of the hip, it's probably a result of a nerve being
Right. Hip
impinged.
pain can send down to the knee, though,
Yeah.
but it won't go past the knee
Right.
very much.
Right.
One of the signs or tests you can do, let's first check for back pain, okay?
Okay.
So get in a chair, and you're going to sit on the chair, and you're going to actually see if there's any knee pain. Then you're going to slump down
Yep.
and see if there's any knee pain.
See if it changes it.
Yep, see if it changes it. Then the final thing to do is actually grab the seat pan
Yep.
and pull up like this and bend at the same time.
So you're trying to pull your shoulders or your head down towards the floor, and that compresses the back.
It compresses the back, and if you're having problems in there, it might make it worse.
Sure.
And that might send pain down to your knee.
Yep. So when you pull and it makes things worse down there, it's more than likely from your back.
Yeah, it's
Your low
very
back.
suspect. All right, next one, Brad. You're going to be in a higher chair, and we're trying to test whether or not it's coming from your hip.
Okay.
So I'm going to check internal rotation. So I'm going to rotate my knees out to the side as far as they'll go. And if one is really bad, especially on the side of the knee pain, that means it's quite often a hip problem you do have a hip problem. I don't know if it's sending pain down to your
What's
knee.
really bad?
If your hip internal rotation, like let's say you're really good on this side,
Yep. It goes way out.
but on this side it only goes out this far.
Yep.
And this is the side you're having groin pain and some knee pain. It could be from your hip.
And probably when you do that, there'll be some pain associated with it.
Right.
Particularly if you push it a little bit, stretch it with the other foot.
You can also flex your hip
Oh,
and
sure.
see how that moves.
So up like this.
Yep.
So we're looking at the hip right here. That's hip flexion. Pull it up. And usually at the end range, in other words, when it gets up closer to your chest is, more likely where you're going to see the feel
Brad,
the
if
knee.
you mind
Oh, you're
staying
going to take a
over
nap.
Yeah, I'm going to take a nap.
Ah,
So
good.
another one is actually, well, there goes there we go. Thank you. Another one is to actually check the hip is to actually bring the hip up to a vertical position.
Yep.
And you're going to take your hands,
Ah.
clasp them, and you're going to push down.
Yep.
And you can even grind around a little bit.
It's kind of like the fader test if you're a physical therapist. Where you
Faber?
Well, there's a fader and the
Oh,
faber. I'm not going to get into the
sure.
details, but where you're stressing that hip
Yep.
with some weight bearing from
So
yourself.
if that increases the pain and it's going down, it refers down,
Yep.
it could be knee pain
Yep.
too. So those are some tests you can do and check and see if we're coming from your back or your hip. It's usually it's fairly obvious.
Right,
I mean,
right.
because you got a referral pain coming from the area.
Right. But this will help clear it up, and you might say, "Why is this going on?" And now you'll know.
Yeah, there you go. Check
There
it
you
out.
go. Enjoy.